Hi there, Angel here, and I am going to take you through the treatment options of our DID, Dissociative Identity Disorder website. So currently there's not a specific cure outlined for DID, and medication is not an option that is necessarily reliable in alleviating all the symptoms and characteristics of DID. Therefore, the main objective of treatment is focused on symptom management so that the individual suffering from DID can live a successful life. As it's been outlined and as you've probably seen throughout reading the different pages on our website here, dissociation is a means of protecting oneself from past childhood memories that are traumatic and painful for the individual to experience and reminisce on. Therefore, due to the fact that DID stems from and is really rooted in these past traumatic experiences, much of the DID treatment is aimed toward delving into and coming to terms with and eventually coming to accept those experiences. So this can be done through psychotherapy, such as cognitive behavioral therapy, which is a type of psychotherapy that aims to assist the individual in altering their behavioral and thinking patterns. And this is done through different strategies, such as exploration of the experiences that might be the cause of dissociation, education of problem-solving techniques, exposure to fear that might cause dissociation, and mindfulness education. There's also dialectical behavioral therapy, which is similar to cognitive behavioral therapy. However, with DBT, it aims to do the same thing to change those behavioral and thinking patterns, but in a little bit more of a structured manner. So there's 5 different stages. Initially, you are collecting information about lost memories. The aim of treatment is outlined kind of after you've collected that information. And then coping mechanisms for unwanted childhood memories are addressed, such as dissociation in a controlled environment. Exposure techniques are introduced and acceptance of past traumatic events is achieved. Hopefully, that's the hope. There's also alternative therapies that can be utilized, such as electroconvulsive therapy, which is more about symptom management than anything else. It's really about kind of alleviating those suicidal ideations and symptoms of depression that come along with having DID. There's also hypnotherapy, which I have read quite a few articles that people found very successful, in which the patient is actually guided into a dissociative or hypnotic state in order to control those unwanted dissociative symptoms. And the benefit of using hypnotherapy in DID is through really removing that negative attention from unwanted reflection of those traumatic memories. And then also, because we are intertwining therapy into those traumatic experiences, therapy really becomes rooted and kind of embedded in those memories. Also, you'll see at the bottom of this treatment page that there's a video that talks about integration and fusion, which are totally a thing that would definitely happen within the treatment section of, the therapy section of treatment. And it just kind of talks about bringing together some of the personalities. Integration is about bringing them closer together. And then fusion is about bringing them together and kind of amalgamating those 2 personalities into one as kind of a means to almost silence or quiet some of those altering personalities, so there's not so many. But the girl in the interview, or in the video, she actually uses some really great examples to kind of walk you through it, so it would be a really good video to watch. And that's pretty much it for the treatment of DID. It's really all about symptom management and kind of combining therapy with medication and alternative therapies in order to really give this person the opportunity to live a prosperous and healthy lifestyle. So thank you so much for listening. Thank you so much for coming. Please watch that video, take your time on the page, and thank you so much. Bye.